Hello and a very warm welcome to the brand new edition of Policy Watch. I'm Kriti Mishra. Today we'll analyze why is it so important to have a policy to authenticate e-pharmacies. The Delhi High Court has ordered a ban on the sale of medicines by e-pharmacists across India. In September, the Union Health Ministry came out with draft rules on sale of drugs by e-pharmacies. The aim is to regulate online sale of medicines. According to draft rules, registration will be mandatory for selling drugs through e-pharmacies, which will be valid for a period of 3 years. The premises from where the e-pharmacy business is conducted shall be examined every 2 years. And to get a perspective on this, I'm joined by Dr. Eswara Reddy, Drug Controller General of India, and also by Kavita Narayan, public health expert. Welcome to Rajya Sabha Television, both of you. Dr. Reddy, let me come to you. How do you read the judgment of the Delhi High Court and what's the way ahead?
Thank you, Kriti. Medicines plays a very, very important role in the public health care. That is the reason we have a regulation called Drugs and Cosmetic Act, under which all the medicines are regulated. The manufacturing, sale and distribution of all medicines that are manufactured and imported into India are regulated under the Drugs and Cosmetic Act. The sale of medicines, as I discussed, it is a part of the drug regulation. But the sale, whether it is through offline or whether it is online, it is not clearly stated. Whether sale means sale of any offline or it is online is a part of the regulation. Delhi High Court, we yet to see the judgment copy of the Delhi High Court. What it is appear from the media is that Delhi High Court has prohibited the sale of medicines through online pharmacy. We are waiting for the complete judgment copy from the Honorable High Court, and as per the directions of the Honorable High Court, we will take a further necessary action.
Right. Kavita, you're a public health expert. Tell me, how important is it to have a comprehensive policy to deal with these e-pharmacies?
Kriti, thank you for that important question. I think sort of where I come from in this regard. We've just, I think, spoken a lot about sort of the need for regulation for health workers, health professionals, etc. in the past. And I think the need, particularly when it comes to pharmaceuticals and drugs in this space, is absolutely critical. We are an extremely under-regulated country. I think one of the things that most people, don't realize is, yes, we are growing. And so there's always this argument around, as economies are growing, how much regulation do you need versus how much of free market do you sort of allow? But healthcare is one space where, I think we can look at most best health systems across the world. You can look at the Scandinavian systems, the Finnish, even the US system, which is not considered a very, sort of from the health system standpoint. But where regulation plays a part is in protecting ultimately the patient and the consumer. So without having tight rules in place and tight, the way in which to do business, if you will, what happens is we are basically putting in danger all of our lives. The people sitting in this room, the people, all the people's lives. So it is very, very critical. So I am a very strong sort of supporter of saying how it is to be done has to definitely be, is the mandate of the government to sort of keep that in place.
Dr. Reddy, Kavita mentioned about protection of patients.
Yeah.
Now, there have been instances where fake medicine or fake drugs were sold online. How will this policy ensure that the patients have access to genuine drugs or medicines?
I think to address this issue, only the government of India has come up with draft regulations. In India, the fake medicine, if you see, we are assessing evaluate the quality of the products that are moving in India. An average under the Drugs and Cosmetic Act, we will draw 1 lakh drug samples across India to test the quality of the products in various laboratories. We have 31 state drug testing laboratories across India, and we also have 7 national drug testing laboratories. To ensure that the quality of medicines that are manufactured and sold in India are as per the standards given under the Drugs and Cosmetic Act. In this connection, out of 1 lakh, if you see, almost 3% of drugs which are available in the market are found to be not of standard quality. Not of standard quality is different from the fake. Right. So fake is generally considered as a counterfeit. But counterfeit, what we seen as per the National Drug Survey, what we have conducted in the year 2016, where 45,000 drug samples have been drawn, in that only 0.03% are drugs found to be whatever you say counterfeit. Otherwise, it is there is no such type of medicines that are sold through either offline or online. But there are some instances, isolated instances we have come across that. In fact, to authenticate the supply chain, one of the mechanisms to address this issue is through online pharmacy. Because through online pharmacy, the medicines are supplied through online, means prescriptions are uploaded through online, and based upon the prescription, the registered pharmacist from the licensed retail premises, he will supply the medicines. Their all transactions, you have a prescription with you, you have your money is purchased through online, money is paid through online, you have a complete all transaction document. So wherever you have complete genuine transaction document, the chances of supplying of fake medicines is negligible.
All right.
So I think this is the one way to address, the availability, or how we can avoid the fake drug movement in the market.
You mentioned a very important point, which was about registration.
Yeah.
So what is the procedure of granting license to these e-pharmacies?
Yeah, so at present the e-pharmacy platforms are not registered under the any act.
Right.
So thereby we don't know exactly at present who are the players, who are the genuine players. They are authorized to supply medicines through online. In order to have control on the sale of the medicines through e-pharmacy, Government of India has come up with the regulations. So the draft regulations we have already published, I think, as you said
Yes.
rightly. So we have received various comments from the various stakeholders, and all that comments we have been examined. We are almost now finalized the draft regulations. Maybe in the next couple of weeks, Government of India is able to publish the final regulations. But with this regulation, then we know exactly who are the authorized persons. They are authorized to sell the medicines through online. In this process, the applicant has to make the application to the regulatory authorities, that is CDSCO, for grant of the registration certificate. But just having the registration certificate, they are not authorized to sell. First, they have to register with the Central Drug Standard Control Organization. Again, they have to go to the particular state from where they are supplying the medicine. From that premises, again, they need to hold a retail license issued by that individual concerned state drug regulator. So it is a two-step process. First, they have to done the registration with the Central Drug Standard Control Organization. Then they have to go to the individual state from wherever they want to supply the medicine, from which premises they are going to supply. That premises has to be licensed premises. So that license is given by the concerned state drug regulator after the verification of the regulatory requirement as per the provisions of Drugs and Cosmetic Act.
So what are the checks that you'll ensure?
Yeah, so these are the checks is that as you said rightly, once in 2 years we are going to be inspecting that premises, and as and when we required any information about that any transaction, the online pharmacy holder has to provide, and also there should be a public grievance mechanism, and also first time we are going to incorporating in the rules, whenever patient requires any information about the medicines, its usage and any contraindications, any adverse event associated with that, and what type of frequency that medicines has to be taken. So the complete information about the medicine has to be provided by the e-pharmacy holder. So for that purpose, now we made a mandatory 24/7, their helpline service should be provided. So whenever patient will have any information required for the transaction of the e-pharmacy, whether it is a timely line dispatch, for example, if any online pharmacy holder claims that we will dispense within 24 hours, then we made it as mandatory under the law, he has to supply within 24 hours.
Right. Okay,
and also as you said rightly, the exact monitoring mechanism is, there is a mandatory provision to inspect even with the experts. We have included, because of this is a completely IT enabled platform. So as a drug regulator, we need assistance from the IT experts to review the data provided in the software, and also we have a separate provision. If any violation of that, there is a provision to take a legal as well as the administrative action against the e-pharmacy holder.
Right, so complete information has to be disclosed. Kavita, coming to you now, and let's talk about the pricing aspect. Do you think that these e-pharmacies can provide the benefit to the consumers, since they would be buying directly from the manufacturers?
Absolutely. I think they can, and which is why I think, much as, we sort of sometimes get very stringent, I think it's important, Kriti, to understand sort of the access issue in our country. If you look at sort of just giving a little bit of a picture here,
yes,
56% of the total healthcare costs, if you look at it, 56 we say, it could be anywhere from 50 to, I would say 55 to 60% is on drugs. It is the single largest chunk of cost for a healthcare consumer is on drugs. And then if you look at sort of, what is our out-of-pocket expenditure, 70% of the country's population spends money, out of pocket is our spends.
Right.
On top of that, if you look at what happens to, people going below the poverty line, every year there's about 6 to 7% families that are going below the poverty line purely because of healthcare expenditure. I mean, it is one of the biggest, impoverishment reasons. So if you sort of, triangulate all of these together, it becomes very clear. And, if you look at one of the easiest things to do is actually give you a medication, right? I mean, you go to the doctor, what's the first thing that happens? Is that there is a medication that is a first intervention that is given, right? A medication, an injection, whatever. And for a lot of the NCDs, as we have the non-communicable diseases, that are growing today, increasing at crazy proportions, diabetes, hypertension, these are all long-standing, there are drugs that people need to take on an everyday basis, that needs to happen. This has been a very unprecedented sort of growth rate for us as India, because, we have been still tackling malaria and, different dengue and different diseases that are vector-borne. Now, as we've suddenly shifted towards these, the drug consumption in general, I think, has just, the need for drug consumption rather has shot up very, very remarkably. Unfortunately, our hard brick and mortar pharmacies have really not taken, it's not like we've grown that many. It's just like the hospital bed issue. We don't have enough, capacity, we keep saying. Similarly, we don't have enough of sort of, brick and mortar pharmacies who can actually physically go do that. So in terms of improving access, which is part of what Ayushman Bharat is trying to do, this is one of the easiest ways to do this. And if you look at the growth, it's only in the last 3-4 years that this segment has actually grown so much. I think it came as quite a surprise, I'm sure, to the healthcare industry, to sort of look at this e-pharmacy business, because it just came out of the blue. But it's a fact. I mean, I have run hospitals and sort of, been closely involved with health systems in the US for more than a decade. So this is a very, very proven model where definitely the cost of drugs, come down when you have, because the whole middleman, the whole bunch of costs actually come down because we are able to sort of go directly to the consumer, which is very important for us to be able to do that. At the same time, unless we ensure that the quality and unless we ensure that the right person is able to, verify that the right drug is going, and I think like Dr. Reddy very clearly said, 24/7 you need to do this, because you could have a 15-year-old going online and trying to, order a barbiturate. And what are you going to do? Somebody has to be able to verify that and make sure that the right drug is coming. So the regulation is definitely essential, but the access issue that it will solve towards universal healthcare by bringing down costs, I think, is amazing. So we have to promote it by also keeping it in check.
So the cost is expected to come down.
Absolutely.
But Dr. Reddy, there's also a very important aspect, which is of data privacy. So what are the rules on data privacy to keep the information of patients and customers confidential?
I think this is a very, very important point, Kriti. In fact, the data which is going to be uploaded on their portal is very, very important, and it is a completely personalized data of the particular patient, because of the entire prescription is uploaded in the system. So where the disease condition of the patient, his age, sex, and all his other diagnostic parameters are stated on the prescription. So when this data is available with the online pharmacy platform holder, the protection of the data is the responsibility of the online pharmacy holder. So we made a mandatory provision that this server should be in India only.
Okay.
So they should not keep the data outside the India. So this entire transactions has to be on the Indian soil, the first thing. And second, even online pharmacy holder, you should not keep mirror image of the any data. So generally people will keep the backup of the data. So because to avoid any misuse of the data, it is very strict regulations we have made with this respect for the data protection. So it is the responsibility of the online pharmacy holder. They have to maintain the confidentiality of that information. However, as and when government desires to have such type of data in the public interest, the online pharmacy holder has to provide that information to the government of India.
But how would you ensure that there's no mirror image?
Yeah, exactly. That is the reason, if you remember, I said earlier, we are going to take the experts' opinion, experts also as a part of our inspection process. So we are going to be maintaining the complete check and balance on their system, and we evaluate their complete first, their portal. Whether is there any chances of backup of that particular data, mirror image of that particular data. So we keep all that tight controls while they are developing the software for such type of platform. And we also utilize the IT experts to ensure that there is no any preference of the data, or there is no any mirror image of the data.
So there would be a digital solution.
That's true.
But Kavita, according to the draft rules, it is mandatory to have 24/7 call centers. How difficult would be the monitoring?
Kriti, this will be a challenge, but like for example, one of the larger challenges we have said that we have 1.5 lakh health and wellness centers where we need to be providing access. So healthcare per se is a 24/7. You're the baby that's not going to come crying out, saying I'm checking the time and making sure I'm going at 6 o'clock. Similarly, a heart attack, there is data in fact on so many of heart attacks and strokes that actually come sort of in the middle of the night. So the very reason for this to have to, sort of have to work will have to be that is going to be a 24/7 operation. Is it going to be hard to implement? I think, I'm sure there will be challenges along the way, but I think it is something that the government is, definitely going to take on and have to do it. In terms of monitoring, there again, I think I will agree with Dr. Reddy. I think one good thing about online is, because we have, and particularly India has proven itself in sort of this whole business of sort of, remote monitoring, whether it is through transcription, where, particularly in the US and, different other countries use India for transcribing, etc. as a back office. We've actually done pretty well. And because we're able to use a whole global set of support, if you will, sort of tech support, telecom support, etc., we are actually able to, I think we will be able to leverage some of those time zones, etc., and ensure once we sort of really build the global bridges to make sure that there will be global monitoring. But without having that happen, I think it is going to be, it will definitely be a challenge. But I also feel it will be done because of technology. I think that, again, the internet will actually sort of ensure that that happens.
So you're also talking about digital solution.
Yeah.
But also, Dr. Reddy, what kind of medicines or drugs would be prohibited for sale on these portals?
Yeah, this step already we have taken in the drugs and cosmetic proposed rules to regulate the e-pharmacy. There is a scope for drugs which they are habit forming nature. There is a possibility of misuse of habit forming drugs. So that's why Government of India in the proposed regulations we have prohibited the sale of narcotics, psychotropic drugs, tranquilizers, sedatives, hypnotics and other such related drugs where there is a scope for habit forming. So such drugs have been prohibited to sale through online. So that's why we have very strict control mechanism to ensure that public should not misuse this platform for any habit forming purpose.
So what are the penalties in case of violation?
So any violation of such a thing under the section 27D of Drugs and Cosmetic Act, we can take the legal action. We can go for a prosecution, and also we can suspend or cancel the registration what they are holding to do this business, and also we can make them penalty as per the Drugs and Cosmetic Act. Once the court is convicted that person, he has violated, he has sold any particular habit forming drugs, there is a fine also under the Drugs and Cosmetic Act.
Right. Kavita, help us understand what's the rationale behind banning these e-pharmacies from advertising on any kind of media?
Having lived that in a prior life in the US for about 10-12 years, I think I can see where that rationale comes from, even though I may not have been very closely involved with the formulation of that process. Again, going back to sort of, how habits form. What has happened, unfortunately, Kriti, again, when sort of greed overtakes industry, which does happen, right? I mean, as growth happens, particularly we've seen, and the US is probably the biggest example of this. Between every 5 minutes of watching some news commercial, there is somebody coming out and saying, do you think you are depressed? I have 10 questions for you. And if I answer those 10 questions, sitting in a traffic jam from Gurgaon to Delhi, I will answer all of those as yes. So it's very easy for you to tell me and make me think I'm depressed. Very quickly, I'm going to be going and asking the doctor and saying, can I do this? And because there is access now, and given e-pharmacies, one of the other problems also is that I may just pretty much go in and without regulation, I will say, hey, you know what? I think I'm depressed. I could really use that Prozac and be happy. The moment I go and do that, now you have started creating a whole demon of sort of drugs that are being taken, without sort of necessity, and then therefore creating, sort of a whole bunch of, sort of issues, which, I don't need to elaborate. Absolutely. So there is definitely the issue. Now, what also happens is there is a lot of, tie-ups that happen between pharma manufacturers and doctors as well, right? We know True. That they will go and say, here's a drug. Of course, we need drugs, but if drugs start getting prescribed because I am going to start getting something out of it, there's a huge issue. There was a law called the Stark Law that was enacted in the US precisely for this, saying that there's a very specific amount of sort of, cut tiebacks or, some sort of benefits that I as a doctor, for example, can get if I'm prescribing a particular drug or if I'm using your implant or if I'm, using, whatever product that you're making. Precisely for this reason, because clearly if I'm going to get benefits out of it, I am going to very quickly start then, prescribing that drug. Now, once I'm advertising it, there is, sort of subconscious, subliminal programming, I call it. Every time I keep seeing that, I'm convinced that maybe there is a need, maybe this is going to solve my problem. Every human being has some ache or pain or ill, at all times. But so much of it needs to be to be treated and diagnosed by a proper physician, registered medical practitioner. I can't just look at a TV or an ad and figure out, whereas human beings are great at figuring out needs. Just like you'll go to a Snapdeal or, you'll go to a Amazon site and order a dress. This is not like that. This is not one of those things that you want people going and doing that. Therefore, I think the thought really behind that has been that we don't want a rampant sort of proliferation of this into sort of a demon that we will not be able to control. by now encouraging advertising. So I think I think that has been the thought. Of course, information needs to be provided. The fact that this is available definitely needs to be provided. But I think advertising then becomes sort of selling that to say, come use me, and I think that needs to be checked.
Point well taken. Yeah. Dr. Reddy, tell us, how would this proposed policy propel entrepreneurship, job creation, reform, and also FDI in the sector?
Kriti, as you know, now we are in the digital world. So there are so many added advantages with this digital technology. E-Pharmacies is one of the great opportunity for investors in India to ensure that the drugs are available to all the needy patients, and also this is more convenient to the patient. As you know, especially the age-old patient, they may not able to go to the pharmacy and get the medicines. So with this policy, the patient can just place an order through telephone or through any media where he can upload the prescription to the particular portal, and that medicines get delivered at their home. And second advantage with this is, patient may not able to get all categories of drugs that are prescribed in the prescription at one shop. If the doctor prescribed, for example, 5 different medicines for the patient, all 5 medicines may not be available at one particular shop. So he has to roam around that place to get all the 5 medicines. But with this type of platform, so you can check in advance whether this all 5 medicines are available with this particular online pharmacy holder or not. So you can place order accordingly to them. So by sitting at home, the medicines are delivered at your place. The second added advantage with this system is, because of the competition, because of this, to promote this thing, so patients are also getting discounts. Because of here, the manufacturer is directly supplying medicines to the online pharmacy holder, and online pharmacy holder supplying medicine to the patient. So many distribution channels has avoided. So the margins generally given to the various like distributors, wholesalers, stockists and retailer, so where margins are distributed among the various distribution channel mechanism, here it is a direct supply chain mechanism.
Right.
So that's why the online pharmacy holders get the medicines at very reasonable price. So thereby he is able to offer discounts to the patients. So this is one of the major advantage. So we may not able to avoid the digitalization of any particular segment. So that's why I think if you see recently, if I understand, already $300 million US foreign investment they have done this. Now if you see online pharmacy business at present, it is around 3,000 crore business. But out of the 1 lakh total sales of medicines in India, 1 lakh crore. The size of the pharmaceutical domestic size industry is 1 lakh crores. So at present, all existing online pharmacies, they are selling only 3,000 crores. So, but we are expecting it will grow. So thereby automatically it will generate the employment for the distribution and also for the supply mechanism, and also for the 24/7 when you would like to have the facilities, you have to have human resources. So that will generate the employment. So we are also expecting government, there is the chances of good foreign direct investment also in this online pharmacy. I think maybe another $500 million are going to be invested to promote the online pharmacy. But I am sure that this online pharmacy is not only ensure the quality of the medicines, and also it will access the medicines will be improved, and it also will create the employment in India.
Right. So it's a big opportunity for India. Thank you so much for joining us. So the much awaited policy will give clarity to e-pharmacies and make healthcare more accessible and affordable. That's all we had for you in this edition of Policy Watch. Thanks for watching and stay tuned to Rajya Sabha Television.